Well done. You succeeded.
I spent half my time in Germany, Hamburg, and the other half in Europe.
Amen. Okay, great. Yeah, great. Yes, and Haifu said that he will choose a place because this isn't close to. Yeah, I was encouraging that as well. Yeah. Thanks for coming by.
Okay, so I think that we have to start. So we start. Oh, do we have a microphone? No? Okay, so let's start. I would like to welcome everybody on the closing panel of Ukrainian House. It's always good to run the closing panel and the opening panel. So just to gather the remaining people, the most powerful people together at the closing panel. So here we are. Just a couple of words about who am I, and then I will present my honored speakers and participants of the panel. So my name is Victoria Tijibko. I'm running the venture capital firm, which is investing in seed and early stage startups in Europe, in Ukraine, Ukraine is Europe, yes, and in US. So we have 136 deals to date, started in 2010, specialized on automotive mobility software and digital health software, and happy to support amazing entrepreneurs all over the globe. So a part of that, we are part of the impact activity, and we started last year the VTech, Women in Tech community. It's non-for-profit. Now it's more than 600 women in this community, those who are running the venture capital, private equity, in tech companies, in different businesses with a high component of digitalization. And it's amazing opportunity for them to interact. They have a mutual chat when they can ask any question and get any answer. And it's working. We have the VTech news, so all the women, please welcome from Ukraine. Yes, it's for Ukrainian women. Please join. And every month we have a special event every Thursday of each month with honored, interesting speakers and the opportunity to talk, to solve your business issues, etc. So it's something useful for Ukrainian community in order to support women in entrepreneurship. That's the goal. In the future, we will send the women to important conferences, pay their booths in different conferences, depending on what they are doing, and get them grants in order to support them in business. And a part of that, we are supporting the young kids. There is a free movement. The name of the movement is Code Club Ukraine, which is a part of the Code Club Global. And we started a couple of years ago, and currently we have more than 700 clubs where more than 10,000 kids from 7 to 15 years get the free coding, basically all the coding languages. And I would like to thank you, MIT, Massachusetts Institute of Technology, who developed these programs in gamification form for Ukrainian kids, but not only. And I'm honored to say that Ukraine was the first in 2013, when the war started, who was the part of the Code Club Global initiative, and now is the fastest growing. So we are growing faster than US, our colleagues from US, which is a good sign for Ukraine. And the goal is this year to have more than 1,000 clubs. And more than 20,000 kids, which will get this free education from the volunteers. So that's about social activity. And I would like to say that I'm so happy to be in Davos. I'm so happy that Ukrainian House is growing. And this year it's amazing. The panels are great. The people are great. The more than, I don't know how many thousand people this year is in Ukrainian House. And the majority of them, 50% plus, are international crowd, which is amazing. And I love Davos also because I met Damon yesterday. And I will tell you why, because I'm also the president of Odessa Film Festival, which is the biggest audience festival in the Eastern Europe, which we started in 2010, with 150,000 people coming every year in July from this year. It will be the 10th anniversary from 12th to 21st, so please welcome who have not been. It's an amazing event. So hope Matt will join us this year. It will be great. And so let's start our panel. I suggest that we will not focus very much on tech stuff. Everything will be about connectivity and predictivity, mobility and health. And I will start with James. James, thank you. James is from New York. James is an amazing scientist, entrepreneur, investor. He's running the biggest worldwide fund, investing solely into the anti-aging longevity companies globally, Europe and US, right? And a part of that, he has a PhD in STEM biology, stem cells, and ex-McKinsey Consulting in New York. So he's one of the most clever people I've met in my life. So thank you, James, for joining. And I'm also the part of Apollo Ventures because this is my hobby, okay? So anti-aging longevity, and I think many people will support us on that. The next to James, and by the way, our panel is about the gender equality, so it's 50-50. Please notice that. So Kira is an amazing woman, girl. She's famous for putting together about 1,000 of developers, tech talent, specialized mostly on AI. And it's not that easy, even in Ukraine. And she didn't know that Amazon will acquire Ring Lab, which was basically started from scratch. There were 3 people. And last time we did our event for investors for iClub, we have a movement for offline entrepreneurs who can invest with the T Ventures in the deals which we are investing. So Kira showed us the office, and there were double space, right? So I don't know how many more thousand people will be there. And she was the girl who maybe made this movement that Amazon will focus on Ukraine as a basic R&D lab worldwide. So then Kira will tell us more about that. And last participant is the Charles Rockefeller. We just met a couple of minutes ago, but online we had a couple of interesting conversations. On the phone, yes, right. Charles is the part of different interesting ventures, focused on healthcare, had an amazing experience working in different parts of the world, in Asia, in US, everywhere. So that's will be my questions will be connected to specifically to that. And he is a member of different societies, councils in US, in Japan. So that your experience will be valuable to our conversation. Thank you for joining. And I would like to start with following. So let's give a couple of minutes to all the participants to tell a little bit about what is your mission with your ventures, with your companies, and then we start with the questions, okay? So James, please, let's start with you.
Sure. Thank you, Victoria. It's really a pleasure to be here. My first time in Davos, so it's a lot of new faces for me. I guess it's a little scratchy. Can everybody hear me okay? Maybe if I just hold... Yeah, okay. So a little bit on the mission. So I started this group called Apollo Ventures. As Victoria mentioned, we are an early stage biotech firm. We invest exclusively in drug development projects. So there is a lot of interest in nutraceuticals and in digital health and in figuring out how to enhance our wellness. But we work just on drugs. How far can we go with new therapeutics and stem cell therapies and these sorts of things to enhance health and treat the diseases of aging. And I guess from a mission perspective, what we wanted to do when we came into this was we noticed that there had been all of these wonderful scientific discoveries in the last decade showing that we can work on, mice or worms or flies and extend not just lifespan, but the healthy lifespan of these model organisms. And so many of these interventions were being made in the laboratory, but nobody knew how to spin those out and start applying them to human health. And so we wanted to bring together a team that could work side by side with the scientists to start building real biotech companies around these breakthroughs in the laboratory. And that's a lot of fun to work on every day.
Okay, Kira, please present yours.
Hello, everyone. This is also my first time at Davos, and I'm so excited to be here. So I'm an entrepreneur, and a couple of years ago, we had this new amazing client. It was Ring.com, who was making a smart doorbell and security systems, and we kicked off with just 3 people, 3 engineers in Kiev office. By the 2.5 years, we've grown to almost 1,000 people, and it is not outsourcing. It is actually developing highly innovative computer vision machine learning technologies. And this is great for Ukraine and great for general community and great for our mission, which is reducing crime in neighborhoods. However, there is more general mission. It's bringing more companies like Ring to Ukraine and expanding and showing Ukraine not as a country of beautiful women and good food, right? But a company of, but a country where many of these high-tech companies can grow. This is what we do.
Thank you, Kira. And Charles, your turn.
Sure. How's that? Yeah. Victoria, first I want to thank you for having us here, but I should especially thank Alexa Chapivsky, who is the founder of Ukraine House, and by extension to her father, Mr. George Chapivsky, Jr., Senior. No, that brought Alexa into the world. So really, I have to go back to the source. So I've always had kind of just a couple of sort of side thoughts. I've always had an affection for Ukraine because Alexa's brother George is one of my very best friends in the world. And when I moved to Washington, D.C. at the age of 11, the Chapivsky family really sort of took me in and welcomed me to Washington and showed me around. And so I'm indebted to them as well as to Ukraine by extension. So thank you very much. And actually, when Alexa said, Charles, would you come speak? She was very straightforward. She said, my other top 5 choices said no. So if you could kind of pinch hit here, I'd really appreciate it. And I will sort of just a little bit now, but I'll mix in more of my response to the other questions, talking about mental health and sort of mobility, et cetera. But a little bit of my sort of personal journey getting into healthcare at all was that after graduate school, I went back sort of at a later age than most. I wanted to do something entrepreneurial, and a couple of friends and I thought that mental health care was something that needed to be addressed and have it be more blended into the primary care doctor's environment. So we started a company that focused on that. And then, so that was my first foray into healthcare, personally. But then, otherwise, I've, sort of grown up around it a lot at the dinner table. My father was a senator in the U.S. Senate. It focused on healthcare a lot. So it's always been in my DNA. And so, in the past few years, I've had a chance to kind of, act on it with my own professional endeavors. So I'll stop there for the moment.
Okay, Charles, thank you. So let's start with you then. So you mentioned mental health, right? So, by the way, so let's do our conversation more productive. I'm a hater of just generic conversation about nothing. So let's put some more interesting content in our figures, stats. So that's what I like, you like. So let's put it like that. So mental health. Only in US, so it's $210 billion industry which is addressed, and every 1 out of 5 people they get their treatment. So the problem is that this huge budget are spent on mental health treatment, but there are not enough professionals to address this huge demand. And the figures are growing and growing. So the question is to you, because you are connected, Charles, to this sector as well, and all the panelists please add on. So what do you think? So where the problem is? So where are we going? How to solve the problem with the professionals? Because this is quite an interesting sector, and how we can use AI, this artificial intelligence and whatever apps, so to address this, and where is it the burden of using the AI, especially addressing this problem of mental health?
Sure, thank you. You're quite right that sort of there's not enough practitioners in mental health to cover sort of everyone that needs it directly under the top. Yeah, and maybe we can do like a shh in the back as well. Yeah. There we go. Someone had to do that. This was my first foray. Actually, so I started co-founded 2 companies. One was a learning company, and so the term mental health now, the more commonly accepted term is behavioral health. and that is to more directly associate it with sort of, the body. Because, of course, mental health and physical health are much more closely related than a lot of people realize. And what we're looking at some, sort of trends, and we saw that like 65% of people in the United States were going to their primary care doctor for what was actually like sort of a mental health issue. They
20% of population, so it's
exactly, and so
scary.
Exactly. So, you can look at, I don't want to say that's a waste of the primary care physician's time, but it's a not as well-directed resource as it could be. So, and the thing is, in the States, that primary care physicians are very afraid of being sued for misdiagnosis, right? So if they, and they don't sort of the, psychiatric community is not connected enough to the primary care community. So what they'll do is they'll say, a lot of people, if you have depression, you don't even understand what's wrong with you. This is unfamiliar, right? So you just go to the doctor and say something's wrong. And then all they can do really is say, like, here's a prescription for Xanax. See you in a year, but that's not treating it at all. So what we created was a better way for sort of a shortened version of a HIPAA-compliant mental health screening done in the waiting room of the doctor's office or in advance, which would not at all thorough as a psychiatrist would do, but a shortened version which would then at least tell a primary care physician a bit of a red flag, right? That they may be eligible for additional care, they might need it. Okay. And so then we created a platform then to have a warm handoff from the primary care specialist to mental care specialist, and then a way for them to be in better touch. And so then, and sort of just make it easier, because anyone going through that needs to have things made easy for them.
And my question is just also addressing the another speaker. So the role of artificial intelligence. For example, we are invested in one artificial nurse company, Sensely, which is quite famous and growing and going from US to Europe now. So, but where is the borderline between offline and online? So where these artificial nurses or artificial protocols written by specialists can be addressed to all the people which need help. I'm speaking about the mental health. Maybe
you should, yeah. Sure,
James,
I'm happy to jump in there. So I think that whenever we talk about mental, or I actually really like behavioral health as well as a term for this. I think it's important to remember that there are really two broad categories of diagnoses driving those costs that you mentioned, Victoria, of mental health. One in a broad category, let's call it the depression and depression-like syndrome, something that affects relatively young, biologically healthy people. And then the other category affects primarily people of advanced age, which is this category of dementias, right? Particularly the one that we know is Alzheimer's disease, which is growing in frequency. And a lot of the costs, so Alzheimer's is the most expensive of all the age-related diseases. It's more expensive than heart disease or cancer, even though it is responsible for far fewer deaths than either of those diseases. And the reason that it's so expensive is because taking care of a person with Alzheimer's is a lot of work. People with Alzheimer's will live with the disease for, sometimes over 10 years. They are very, very, like, as one's mind goes, they become very, very difficult to take care of. They need a lot of attention.
Very taxing for the family.
It's very taxing for the family. It's taxing for the caretakers. There was a study done a couple years ago showing that caretakers of people with Alzheimer's disease develop behavioral dysfunctions themselves, behavioral illnesses themselves. And so I think that to directly answer your question on AI, I think that there are two approaches, and I can't comment on the depression side because I mostly think about the diseases of aging. There are two approaches where I see AI coming into play on the age-related dementias and kind of impacting the healthcare costs here. One is that as we have a population that's aging very rapidly, we have to accept the fact that we will not have enough human caretakers to pay attention to these dementia patients to the extent that they really need and deserve to be paid attention to. And so there's, like, with a bit of a bit of optimism, but also a bit of tragedy, I think. I've seen a number of companies who are working really with compassion as their primary motive, trying to develop artificial intelligences that will talk to and interact with these patients whose minds are going. And what the one thing that is known about Alzheimer's disease is a very hard disease to interact with, but if people are very well socialized, they interact, they like have a reason to get up in the morning and they talk to and have some kind of stimulating conversation, that slows the progression of the disease in a large proportion of people. But most patients can't get that. And so developing ways of just, almost like chatbots, right? Interacting with this person on a regular basis, challenging them, making them use their brain, that is a very strong tool that I think we will start to see more. The second tool, and sorry to expand on a little bit, the second tool that's more in the field where I work on is in drug development, right? We're right now in the middle of a revolution in both our understanding of the basic biology of diseases like Alzheimer's, and also in our ability to create new drugs. And so I think AI plays a very big role in accelerating pathways forward of assembling new chemical molecules that we can then test in the diseases of aging.
James, thank you. Kira, can you go on? Because, Amazon is doing a lot for the home, for security, home security, then health apps, and everything will be connected. So, and speaking about all these issues with mental disease, Alzheimer, and many others, so are there any interesting insights which we can share you are working at, especially in this sector?
Okay, thank you. Yes, so not only talking about insights from Amazon, but from my personal experience and from the friends that I have in US. So agree with everybody. The chatbots are really useful right now, especially for the mental health. I have personally a friend who was preliminary diagnosed depression by some sample chatbot at the doctor's office, and then she was directed to the professional. And it was great because she was suffering for some time. And second one is more interesting, is that we should not expect AI or machine learning to treat people at the nearest future. This is not going to happen. But what will happen, what's happening right now is creating the red flags, providing to the doctors the help that they need, saying, hey, you have been working for 20 hours. Take a look at this one. So we in Kiev have a company who is working on the X-rays of people with Alzheimer's and identifying the first signs, almost invisible signs of Alzheimer's in people's brains, and putting the red flags on the X-rays and providing that to the doctors and saying, hey, you need to pay more attention to this one. This technology will never treat Alzheimer's, but it will help a doctor not to make a mistake. And it will not put a diagnosis, but it will help to just take this piece and progress with the treatment.
That's an awesome point. Yeah, actually, one of the most recent advances in Alzheimer's disease that I just heard about in the last 18 months or so is actually, it's so funny you mentioned X-rays, because there's new evidence that so the fluid that drains through our brain is what normally clears the amyloid plaques out of our brain in a healthy person. And as people age, you actually get buildup of bone in what's called the cuneiform plate right above our sinuses that is highly associated with Alzheimer's disease. So people of the same age, if you have more bone buildup in this cuneiform plate, you're much more likely to have mild cognitive impairment.
Yes, and
so it's really interesting.
As the doctor, you may not know that, but as the machine learning, you will say, like, this is the feature that is usually developed in the brains of people with Alzheimer's.
Exactly.
That's the help that we can get.
This is science that's less than 2 years old, so most physicians looking at an X-ray of a skull won't know it. That's super cool.
Thank you. So, James, question to you. So why biotech, why anti-aging longevity? So there are a number of sectors known to us, like 9 sectors, rapamycin, all these interesting sectors, all of them 9, and please name them, so explain a little bit, in the audience there are not everybody who is connected with this sector, so we understand clearly so what that, and why you've chosen that, and which one has more progress and achieved progress to date, and maybe you can share some insights, so where we are, where to bet. So Is it autophagy? Is this senescent cells? Where we have to bet? So where everything is going?
Okay, I like that question. We're going to get a little bit into the science then, but I'm going to try to not be too
That's why we are here.
too lectury about it. So Victoria, as you mentioned, one of the things that I think really spurred the creation, not just of Apollo, but of a number of different efforts targeting the biology of aging as a way of addressing age-related diseases, has been this scientific consensus around what we call the hallmarks of aging. So these are 9 different factors that scientists have pulled together that seem to represent the categories of things that go wrong with all of us as we get older. And instead of going through just like a list of these things, just kind of to put some ideas in your mind, our DNA is constantly mutating as we get exposed to the sun, right? We know that this is why we put on sunscreen to reduce our risk of melanoma. So DNA mutations are one of the hallmarks of aging. Another thing that happens is our metabolism starts slowing down and it doesn't respond to signals the same way. This is another one of the hallmarks. A third one is like our stem cells start getting exhausted. A fourth one is that as our non-stem cells divide, they get old and sometimes adopt a toxic inflammatory state called senescence. So like those are a couple of different examples, but we don't need to go through the full 9. That's just kind of like a snapshot. Some of these things will be very, very, very difficult medically to intervene with, and some of them are easier. And so the reason that this field has begun exploding and like now has kind of been the time to create translational efforts around longevity and aging biology is that there are a few things that are low enough fruits to pluck and start putting into the clinic. And for us, there are basically 2 or 3 things. Let's just touch on 2 very briefly that we're excited about. One is in our ability to do nutrient sensing. So inside of a cell, there is a protein complex. I'm sorry if I'm getting a little too sciencey, but there's a protein complex that is the master kind of sensor and controller of how we respond to nutrients. When we eat, do we make insulin and turn that food into fat, or do we use it all in our mitochondria and turn it into sugar right away because we're using it? And that protein complex is called mTOR. And about a decade ago, we figured out that if you use a drug to slow down the mTOR complex in a mouse, that slow level of mTOR throughout the mouse's life allows it to live longer. And not just like, a little bit longer, but the equivalent of about 25%. So if we were to, flip that to humans, that would be like our average lifespans are about 80 right now. It would be 100 instead. That's a big jump. That's much larger, for example, than what would happen if we cured cancer, like all cancer. And that's pretty exciting. We don't think that the jump would be that big in humans, even though it's that big in mice. But in the last couple of years, we figured out safe ways to do this and are advancing those to the clinic. So there's one that just finished a phase 2 trial, a company that went public last year called Restore Bio. And then there's another one with probably some improved compounds, but at an earlier stage that we invested in called Aeonian, that will start clinical trials, actually not for aged people, but for a rare disease, for children that have a mutation in this mTOR pathway, where we'll start treating these kids next year in 2020. So that's one quick one. And then the second one, just in 30 seconds, is in senescent cells. So we have these cells that accumulate in our body as we get older. Again, about 5 years ago, a group of scientists in San Francisco and Minnesota showed that if you eliminate these cells, they made a very clever genetically engineered mouse that could pull these cells away from an adult mouse. And if you take these cells away from an adult mouse that cause problems, the mouse lives longer again, 35% this time. And so it turns out that humans have about the same frequency of these cells as mice. We think that they also cause problems in the same way, although this is kind of to be determined. So one of the cool cutting edges, and there's a slew of companies, we have one, but there are a couple of others around, are trying to find special mechanisms that differentiate these cells from normal cells, just like cancer therapies try to figure out what the specific vulnerabilities of a cancer cell are without killing normal cells. and then exploiting those specific biological vulnerabilities to eliminate these cells in a human. And so first clinical trials for that, another company went public last year because 2018 was kind of like the first year of the longevity age, I guess, in medicine, we could call it. First trials started last year, this company that went public called Unity, but there's, again, we and a series of others have some interesting second followers in the space with, better selectivity and some cool biology behind it. So
when we will have these drugs available for us, and how longer can we live? Let's speak about 10 years span, because and let's also integrate sort of the Ukrainian angle, because we've been discussing the opportunity to do some mice clinical some trials in Ukraine, and please tell us about the problem in this. So it's hard to make these trials. There are the queue. There is no possibility now to do it or expand. So what's going on in U.S. with this? So what the problem, and why not to do it in Ukraine? Because as far as we explored already, Ukrainian legislation is more ready for that, and there is a whole lobby in European Business Association in Ukraine supporting that kind of trials on mice, whatever, and then even on humans. So let's talk about this. So when we will have something ready, the path to this through the trials, and can we build something like labs, whatever, in Ukraine?
Sure. Okay, I don't want to dominate too much of the time.
No, we are so interested, yeah.
Okay. All right, so starting off there, we haven't talked too much about human trials. I have a strong bias for human trials being done. So for better or for worse, the Food and Drug Administration in the US is the world's kind of bottleneck for what we consider safe and effective drugs. And instead of trying to go around that, I think if we want to make a big impact on the space, we have to figure out how to fit into that stream as opposed to trying to go around it. Otherwise, we're going to end up affecting a minority of the population instead of the majority.
But by bottleneck, you mean preventing good things from being created, is that right?
It does both, right? Prevents bad things from getting the market and also sometimes slows down the pace of good things getting there. Specific to the aging space, the human clinical trial regulatory problem that we have right now is that for a number of reasons, not just the FDA, but also business reasons, it doesn't make sense to try to test a pill for its anti-aging properties. If I were to, let's say, we had a pill that could extend lifespan by 35%, right? Everyone in this room would probably say, I want to take that, right? It'll make you healthier, it'll make you live longer, it'll prevent all of the diseases of aging. And then I would have to ask you, okay, how do we do a clinical trial to test if it's really working? And the way to do it is to have, this side of the room take the pill, this side of the room take a placebo that doesn't do anything, and then wait 30 years to see who gets disease. And that doesn't work for pharma companies. So what we need to do, just really briefly there.
No, speak louder.
Oh, sorry. So what we need to do here is figure out the biomarkers to get an early answer of whether something is working or not. And in order to do that, we need to do a couple of long, difficult proof of concept trials. Those are going on right now. And then simultaneously, we need to develop the drugs that have the potential to have this, what we call geroprotective effect, or age-slowing effect, and use those drugs in other conditions that already fit within what we think of as treating disease. So for example, our mTOR company, as I mentioned, it's treating these children with a mutation in their DNA that have overactive mTOR. Our senescent cell company, it's not treating just old people generally. It turns out that senescent cells are very similar to cancer cells. So we're treating specific cancer patients and also specific people with certain types of muscle weakness. And so by taking these stepping stones on the way to a broader opportunity, we can get there. But I think it's going to take 20 years for the regulatory system to come around and the right trials to be finished such that those of us in this room could be prescribed these drugs from our physicians. Then last point, just really briefly about Ukraine. One of the things that's not happening in this space that you and I have talked about that makes me both sad and excited is that because there are 9 hallmarks of aging, affecting or fixing any single one of those will only have a limited effect. right? We can get a 25% or a 35% lifespan increase, but what about when we start combining multiple things together? That's where the health of an organism will really be able to make leaps and bounds. But right now, there's nobody doing those studies. We have no idea what happens when you start combining multiple working ways of slowing the aging process together. And so one of the things that excites me about a place with an incredible operational capacity like Ukraine, as we've talked about, is that we could have, as funders of biotech companies, an incredibly capital efficient way of doing these long-term studies that feed into everyone's, certainly my fund's long-term mission and long-term vision, without some of the concerns that would come from mainly financially motivated from running this, if we were to do it in Germany or in the US, where it would cost much more, and you would have...
The regulation is not there.
And the regulation is tougher.
True. Kira, James, thank you, Kira, question to you, because you are fortunate not to deal with FDA and US legislation,
Yes.
etc.
Yes.
Drugs, discovery, etc. So it's quite a hassle in this topic. Question to you, because you've built and you make it basically breakthrough in Ukraine. So with this 1,000 plus people and more will come. So my question is, can we count that part of these people will go into the sector of different sectors where AI basically is mobility, connectivity, security, home, health, etc. So, and just want a little bit of your visionary thoughts on how it will happen, because these talents, I would love them to join different startups, and these startups will start operating in Ukraine. So can we count? So do you see this happening already? So maybe you can explore a little bit on that.
Let me do something first.
Okay.
That's very useful, Charles.
Thank you, Charles. Okay, so when we kicked off a couple of years ago, there was a limited amount of computer vision machine learning talent in Ukraine. Right now, with all the other companies, we are building a technical pool of these people. So we are working with universities, we are working with different schools, and we are growing this talent not only for us to be able to have fresh blood every year, but for other startups to come. So there are many people who work for us for a couple of years, and then they feel that they are able to do something else, something more, and then we support them because it's in our interest to keep in touch, because still the AI community in Ukraine is pretty limited. And then we just either put them as a separate startup in our company or support them with their startups. And then they are going and doing something else with the knowledge that we have. Sometimes they return, but the main thing is just these startups will appear and elaborate. We need to create enough pool of professionals in Ukraine so everybody could feed from, right? So that's the main goal of what we are doing right now, is supporting all innovative initiatives, all educational initiatives with different educational and universities and educational funds.
And maybe there is a chance somehow you can, Kira, persuade Ring and persuade Amazon to make sort of the accelerator, Ring accelerator, Amazon accelerator, focused on AI in Ukraine, because we do need their help, their knowledge, to develop separate companies, and they know how to integrate these companies into their big, huge ecosystem.
This is in works. This is in works right now.
Okay, so great news, yeah? Great news. That's exactly what we need. Charles, a little bit, let's come back to your experience in Asia. In Asia, Vietnam, so destinations, so just healthcare. I experienced several times, I was so pissed in US, also in Europe. There are some destinations where you basically cannot get this help. And in UK, for example, then you can try a couple of years ago, before Babylon Health, before our Zesty platform, which we invested there, and the life is changing for the better, basically in 2 years. So how come then in such a developed destinations, you spend billions and billions on drugs and etc. So that to have this a system with doesn't healthcare system with doesn't work. You cannot have the first care. So how it works in Asia? So just maybe your own experience. So maybe some learnings, because it's so different, and would love to have your insights. So what can we take for Ukraine, for US, for Europe, so out to our friends in Asia?
And just to clarify, you're referring to how the healthcare system in the States is disconnected from other countries. Is that what you meant to say?
Yeah.
Okay, sure. So just a quick thing is, on longevity. Fortunately, I'm on. We'll talk after, but something called the National.
Speak louder.
Shh. So the National Academy of Science put me on this council for longevity. We'll talk about that, because they're collecting sort of people from all over the world.
So business started.
To do this, yes, yeah, exactly. Part of the point of this is that different people should be doing business with Ukraine and elsewhere. And in terms of Asia, and I'll say one thing in terms of the FDA, as we were all discussing before, we've had not issues with that, but we had to go elsewhere to try some things that we wanted to try. So we're doing a project with the University of Heidelberg in Germany, which is quite a well-respected place. There was one professor there who sort of reached out to us, and likewise. So we're doing, helping them do some studies on predictive data analytics in terms of which women are most likely to get postpartum depression. And unfortunately, this wouldn't be allowed in the States. But that's another sort of part of the integration of mental health care and primary care. In Asia, sure, I mean, I don't know where to start. I spent a lot of time there in the last couple of years, and the big thing there, I guess, is about localizing for their local market. So unfortunately, a couple things with sort of China are put on hold because the State Department has issued, a suggestion to Americans to not go there. But luckily, we put some things in place last year. We can continue on remotely. And I believe, you'd made a point earlier about sort of, how is it that Ukrainian companies can, as they look at other countries, sort of doing business and the localization process, like. My only advice on that would be you have to carefully research it in advance, and don't go there until, or hire a local. My company has a head of China initiatives, so he's our advisor on that, of course. But through a project that we did in Taiwan, someone there spoke to someone from the municipality of Shenzhen, and so out of the blue, we actually received this RFP from Shenzhen to, it was, actually sort of 800 pages in terms of, just creating a more efficient way, because our company sort of, finds inefficiencies and solves them. And then we made some suggestions, and maybe they were kind of even afraid it was too disruptive or something, but then they sort of paid us to go away, actually. But in a funny way, it was like free research that we profited by doing research and preparing us for the other things we wanted to do in China. So yes, that's a big thing. So you have to have a local partner there. We have local partners in Suzhou, Nantong, and Beijing and Shanghai. You have to have a local partner to establish trust. With whatever government officials might sort of be checking in. And the product has to be tailored even, for the very specific market. So even in the way that it's, sort of a Chinese person would look at a screen in a different way, and what is more intuitive to them in terms of where to sort of, take the next step, et cetera. So you have to think even down to that detail. So there's, sort of our sort of American version, but then the Chinese version of it almost looks quite a bit different in terms of just the navigation. So you have to research that really carefully before even beginning the conversation. I imagine it's more so the case in China than sort of, other countries in Europe, but it's just, they appreciate when you have shown a great amount of detail in learning about them. Same for, less so for the things that we're doing in Seoul and Japan, but they appreciate that. Takes often a year, mothers I've heard, just to sort of get started, and you have to show up there. You know, like I went to China. I mean, like to brag about this one or something. In 2017, like 8 different times. So you really have to put in the legwork, and they notice that and appreciate it.
Yeah, that's exactly, so answer the question. So when it's centralized, then you have the result. When it's more decentralized, then it's easier to get a proper health care. I mean, even for those who is ready to pay. So it's totally different from what we have in UK, for example. So we can explore long on this. But I would like to go. Maybe Kira, to address you one interesting question about these 100 million devices, all this IoT connectivity, health apps, whatever. So and it keeps growing. And speaking about the people, coming back to this question, so there were interesting research on how the people with this Alzheimer, the people with the mental health disease keep speaking with Alexa, and there some feedback on how helpful was it. The people, people after any drama or problems or losses, whatever in family. So how these devices, this IoT helps them to overcome these issues in different, whatever. So what is going on currently? Security, home, healthcare, apps, Alexa, 100 million connectivity. So where we will be in 5 years. So by different reports like McKinsey, whatever they predict in 5 years, 50% of devices will be home devices will be connected. So how we can use it and with the help of what you're doing with AI.
Okay, so where we are right now, right? So first of all, we are collecting tons of data. So that will help analyze your lifestyle, and do some health prediction, some personalization. So for example, you see like I'm wearing the bracelet that tracks my how much I walk, how many steps, and how much I sleep, and certainly like some heart rates, etc. So we are already able to make some predictions on that and say, hey, Kira, I'm not getting enough sleep. But there is more information coming to, it's from when you're talking with Alexa, of the timbre of your voice, of how many times, or like if you're crying, for example. There is a data that we are processing that's coming from your car of how you're using. And this data will be accumulated, united, to better serve not only for your convenience, but also to support your health, to do some personalized predictions on your health. What you, like the simple way right now, what you're having is, the predictions on the healthcare apps, which is you need to go to sleep, and or probably when you are in a sound sleep mode, or not sound sleep, light sleep, when you are waking up. What will be the next step is analyzing the blood, the heart rate, that will be able to predict when is, and these researches are already in place, to predict when you will have heart attack, to predict when you are having next epilepsy attack, etc. In terms of where we are going to be in 5 years, I like to say that we all have seen those sci-fi movies, right? When the person is talking to their homes and talking to their cars, like having as a personal assistant. This is the closest and the most certain thing that will happen, that we already see. All those systems uniting, and all those systems being able to interact with you like another human. And also being able to help your health, longevity, help you to remove some unusual, unnecessary stuff from your day when you are talking to your home, and able to get some suggestions when you're talking to your car, and able to have a conversation like with a normal person. This all gets us tons of information and tons of big data for processing that will allow us to do really magic predictions about, based on your day, based on your habits, based on the results that personal health devices are getting for you. And even right now, like one of the startups that we have in Ukraine is the bracelet that allows you to track the stress level, and the bracelets and some devices that allow you to see if your father or mother or whoever is wearing it having troubles, and monitor that, and message your phone saying, hey, the person who is wearing that is in trouble and having some serious health problems. And this is the first step, but in 5 years, that will be all united into certain systems that will gather data from different sources and will be able to do the predictions.
Yes, I just would like to drop the question a little bit in this way. So I would love to have one device, one bracelet, where you will have everything. And you've seen so many IoTs, gadgets, I mean, tracking this, that, I mean, vertical, horizontal, different. So the idea is to have one, track whatever you can, all data you can collect with one device, and plus to add to this personalized medicine, right? To understand the certain advices on how to, what to take, which supplements to take or not to take, how to track your blood tests on how regular, and then just to understand what we have to eat, how to eat well, how to track with blockchain or whatever, from grain to your table, so what are we eating, and just unite all these practices in order to predict what will happen if we will not follow this, and how to live longer, how to, in the near future, like in 10 years maybe, to be able to predict the majority of the diseases. And that's the question to James. I would like everybody just drop your ideas on whether we will be able to live with one device and plus take some personalized drugs, or maybe have to add on something to this. So, and when will it happen? That's important.
I will just jump in quickly on the infrastructure part of if it will be one device. Yes, so like 5 years ago, you could have seen for the smart home solutions, there will be tons of them, like different ones. Right now, they're starting uniting and connecting to like some single devices of the, obviously, Google, Amazon, some most two biggest players. Same thing, right now, there are many health devices. The best ones that will survive on the market will start uniting, integrating into each other. They already do. Like right now, this bracelet, I think it integrates into some smart shoes, it integrates into pacemaker, it integrates in the gym into the treadmills and tells you like, so you wouldn't cheat. So, yeah. I wear it for a long time. You're smiling. I did many things with it to make it like count additional steps. So yeah, within the next 5 years, it will at least go down to 2 or 3 major players.
Okay, and Jim, so what will add to in personalized drugs, or what you have to take to live longer? I'm not ready to wait 30 years, another 30 years, so I want now. So what we have to take, plus device, or just
I think I think that this builds nicely on the last point, because I think that there is a convergence happening with a device to measure, let's call it the obvious things, right? Your heart rate, your sleep patterns, your stress levels. These sorts of things are things that every single person will want to track, and there will be a unified device. Now, one of the other parts of your question, though, was, can we use the same device to predict your risk of Alzheimer's and diabetes and aneurysm and cancer? And that's going to be a lot harder, because there is just not a scientific consensus on what the extended set of things should be that could potentially be included. And in integrating any of these more advanced assays into a device, some of them will be relatively simple, like testing your insulin levels and insulin spikes. I think that's one of the things that might come into this main device. But something like, all right, in order to predict your rate of cancer, we need to detect your average mutation rate of DNA. And that will be a risk, like a thing that will determine risk of cancer. Is that really a necessary feature in this device that's going to go to everybody? Some scientists might say yes. Some scientists might say no. We will be able to figure out in 20 years, right? Like, these are going to be hard things to figure out on a biomarker level. And so I think we're going to get there with my point is, I think we're going to get there with the obvious things, but with the non-obvious things, it's going to look a lot like what medicine looks like now for at least the next decade. I don't think there's a super strong push that's going to completely revolutionize things on the med device level from the perspective of how we deal with age-related diseases, except in so much as we can address those things with better nutrition, better sleep patterns, like lifestyle interventions as we have it now.
But isn't the simple things that will make average person's life easier and longer just by the thing that they will exercise a little bit more, eat a little bit less, and sleep a little bit more.
By the way, tell the audience about the eating less. So it's, I mean, the simplest thing which we can do. So there are amazing research, and it's already there. So just eating by 25% less will increase by 25.
We don't know if that's true for humans, but at least the aging research field was born in the 1930s when a group of people, a group of scientists decided to feed rats less than they would eat if they were given an infinite amount of food. So normally animals were kept with food in the dish, and when the food ran out, you would give them more food. First scientists were like, no, why don't we measure how much they eat normally and just reduce that by a little bit? And it turns out that those rats lived a lot longer. It's called caloric restriction now. So probably, and this is kind of morphed a little bit in the last few years, many of us are now probably familiar with fasting. A lot of people practice either intermittent fasting, where you go and eat for only 8 hours a day, or you do what I do, which is to fast for a full day once or twice a week. And it looks like this is very correlated with positive health effects.
2 times per week you don't eat?
1 to 2 times. So it depends on the week.
24 hours or 30 hours?
I do 24 hours, so dinner to dinner. And
so he knows, okay? Yes, 2 times. Next time, these 2 days should be in Ukrainian house. So 2 days we have to mark down. So we are on fasting. 2 days out of 1 week in Davos, fasting, okay?
Yeah.
So anti-aging, longevity, done.
Yeah,
He's 61 years old, by the way.
That's right.
That's another question.
But the key point, and I think that the reason that this device that we're talking about, and then the ancillary services that will come around this device, so generally where the trend is going to go in the next 10 years as we start getting new data and new information, the key jumps will come from being able to understand what each of our individual bodies need. Fasting will work really well for some of us, and it will work poorly for others, right? It will make other people feel sicker and less good. And figuring out which one of those you are without having to do what so many of us are doing now when we try to optimize our health, which is tons of what I call N=1 experiments, right? Where we test something, we try it for a few months, and then we're like, do we feel better? I don't know. Should I use this brand of multivitamins or that brand? Oh, I don't feel any different. There are absolutely better ways to measure what is going on and what we're doing to our bodies and what's working. Which multivitamins am I taking?
DNA. I mean, DNA. We have to
what
do what we have to do just to have the personalized picture. So what we have to do, because you're totally right. So fasting is good for somebody, not good for another. Somebody has a problem with the immune system, no fasting. So I mean, the people just do not know this. So we have to have more data and more information for people which are just trying something which is absolutely dangerous for them. So my question is, so how to start from the very beginning? So at least with the knowledge we have today. So make a DNA test or whatever. We'll ask the audience who did already. I did, maybe somebody not, but just your point of view on this. Then do the blood test once per day, once per week, because personalized is about tracking during the long period of time. So what else we have to do to understand what is dangerous and what will work good?
So this is the part where I have to say, I have a PhD, but a PhD makes me a real fake doctor, not a real doctor. And so I try to shy away from giving medical advice. And this is kind of where we're coming into. As our knowledge increases, what we need to do is kind of fuse the best of performance and health-based medicine. So there's this burgeoning field of medicine targeted at prevention, and people who know a lot more about this and the individual risk factors than I do, with the sort of stuff like our X-ray point that Kira was talking about, where we use AI-enabled data gathering algorithms to help people diagnose and understand themselves with the help of a physician who is somehow overseeing this. So I don't want to prognosticate and say, like, okay, everyone needs to go out and measure their testosterone levels and their cortisol levels and make sure that their cortisol stays in this range and blah, 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 because it's going to be different for everybody, and I'm not the person to.
That's exactly. So
to
we
talk
have
about
to,
this.
yeah, we have to track both data available
And so I think that
tests.
if we want to be doing the best that we can do right now, my recommendation is just like make a commitment to start understanding yourself with the help of a physician, and like go find a good partner there and go on that journey together and figure out what works best for you. And from an investment perspective and kind of a building perspective, like I hope all of us are thinking about, we want to think about how to pull that data from lots of different people who are on those journeys together in a way that can kind of create some level of scientific consensus and improve the quality of what we know about ourselves.
Yes, like +1 on that. So the best doctor that I ever seen on the matter was just saying, don't believe any generic advice that you're given. You need to, whatever advice that you get, it needs to be tailored to you. So that's why we should collect as much data about ourselves, our lives, our habits, our trends in weight, feelings, and blood work, whatever, so that there will be enough data for the doctor to predict something. And that's where we go back to analyzing DNA, analyzing big data for different people with different particular genes. This is where the 23andMe and my Helix and other startups are upcoming, and analyzing tons of data. And what we can do is just help gather this data. And obviously about yourself is the most important one.
Thank you. So coming to maybe two last questions, and then we will ask the audience, ask questions to the panelists. So speaking about the talents, question to everybody. Let's start again, Kira, with you. So being the female running the company with 1,000+ people. So how hard was that? So can you explore on this, on how many women in your organization, female director, and going forward? So is it easy to attract the talents? How does that work with you?
Okay, so I'm working in Ukraine for like a really while, and my original story is not so fancy, because when at my first job, when I was to be promoted to be a leader of the team, my tech team said that they don't want to have a woman as a leader. It was like 10-something years ago. And it was pretty hurtful. And right now, when I'm managing a large company, I promote and help all the women leaders that are in our teams. Last year, I've been to Stanford Women Leadership course, where they gathered 60 women from all over the world who were either leaders or owners of the company, venture capitalists, etc. And the most important thing that I learned there was, first of all, that all the same problems are all over the world. So women are facing same issues, same challenges all over the world. In India, in US, in Australia, in Ukraine, in Africa, everywhere. It's the same thing. And the main question of this course was, what can we do to help that, right? Not only talk about the problems that we have. And the answer is, help each other, promote women in your organization, mentor women in tech, organize communities where women can come together and talk. That's why it's so important what you, Victoria, are doing, the VTech community in Ukraine. So that is the thing that what we can do. About my experience and our company, we have a really enormously high rate of women leaders in Ukraine. We have 36% of women working. This for tech, it's a really huge amount, and 30% of our managers are women. And I'm super proud of that. We are promoting them with whatever chances we get. And I encourage everybody to do the same.
Kira, thank you so much. And James, question to you. Maybe you can tell us how many women is in your organization. In my company, it's 50-50 almost. So, yeah, so I'm happy. Yeah, it's not pure tech. We have festival, we have some social impact activities, so it's easier, but we will work on this. And then maybe a little bit more specific question to you, because your model is quite different from others, from Apollo Ventures. So basically, you find talented scientists in different labs. You help help them meet. Then you manage these crazy issues on IP rights with the labs, with the university, blah, blah, blah. And then you help them, wrap them into the business somehow and help them to develop, grow, skyrocket, and then at the end maybe acquired or be a standalone companies, acquired by big pharma, whatever. So how does is so difficult? So scientists, entrepreneurs, I mean, it's like, I don't know, it's quite hard to be a scientist, so you may be like a rare example of the person who can combine both. So tell us a little bit more, so what's going on in this market, because these guys and girls, they cannot sell them, scientists. And it seems to me that we are losing a lot of potential with the scientists which cannot find the proper business partner. It's like in a creative art. So you can be amazing singer, but without manager, I mean, you die. So tell us a little bit more. So what's going on? What changes are in this industry?
Yeah. So we've spent a lot of time talking today about how this industry, and particularly in my space of biopharma or drug development, it's growing really fast, right? And a lot of excitement is coming in from the outside, and there's tons of money pouring in. And so your question is kind of like, okay, who's going to build these companies? Who's going to lead these organizations? And in science, historically, the best results come from people that have deep content knowledge, right? And so it's primarily scientists and physicians that have gone on to be the best leaders of pharma companies and biotech companies. And so coming from an academic background, one of the things that is the biggest problem in biotech right now is that there is a shortage of leadership quality talent. Not because there are no scientific leaders out there, it's because there's not enough pull getting them from the laboratory into the industrial world, right? So when I was a student doing my PhD, when I told my mentor for the first time that I was going to go work for pharma companies as a consultant in New York after my PhD instead of going and doing a postdoc in a lab, he was like, why are you going to waste all of this time that you've put into doing your PhD to go work for pharma companies? And that is pervasive, and it's actually more pervasive in Europe than it is in the US. So there are a couple of ecosystems in Boston and in San Francisco where they have done an excellent job cultivating an environment where young scientists are encouraged to think about translational medicine and going into biotechs as a career path, but it is by far the minority of scientists that are being trained. And so what we do at Apollo is a big part of our work is being bridges where we have, like, so my team is almost all scientists, right? We have a team of 11 on the venture side. 9 of them have PhDs in aging biology. And so we go and, like, we'll read a paper and say, like, oh, this is such cool science, and then we'll go and reach out to that older, like, more mature scientist or the younger scientist that did the work and say, like, let's teach you what it would look like and why it's still real science that we're doing drug development. And so I think to kind of directly get to your question, what we want to be fostering is a global ecosystem of making it more exciting and acceptable for PhDs to kind of jump into their own projects, kind of emulating the successes of the San Francisco and Boston micro ecosystems.
One of the things that reminded me, when we started the company in Ukraine and we were looking for really exceptional talent, we were going through universities and we were going through some forgotten Soviet factories where people who were doing helicopters are now still working there and not doing helicopters. And we were, just as you say, just taking them from there and saying, here, they think, oh, we are doing exceptional science, and we are saying, no, but you can do something that will go into the hands of millions of people. That's where you need to concentrate. And it was like a hard journey, but this is something that is possible to do. And they are right now one of our best performers. They're great people who went from science to actually business and developing something that that would go into hands of real people much sooner. Same goes with not only with tech industries, but with biotech as well, with different science institutes in Ukraine, where people don't have funds to continue on their projects and their research, and who will be happy to jump into real business. So we have the MyHelix that we have read about, that is like 23andMe, but in Ukraine, that was started by 2 women who were also doing their research and then started the business, and this is a successful business right now.
So then I have the idea, so maybe we have to do like a science lab in Ukraine, because
Yes.
that's exactly what's happening. So a lot of scientific resources and talents and specialists in that specific sector and many others, they just useless. Nobody can help them to find the business partner, create partnership, like exactly what you are doing, James. It's an amazing example. So where the science plus entrepreneurship should go, and we have a lot of opportunities in Ukraine, so we can consider that. So to sum up, just one question to everybody. The panelists. So tell me, please, what are you taking in order to live longer, live happier, and your day. Some life hacks, so some interesting insights on for all of us to live happier, healthier, etc. So let's start from
I'll start off with
Charles.
I had 6 of the Ukrainian sweets over there right before we sat down.
So you was eating the beehive. It's an amazing project out of Ukraine, and there are a lot of tech and creativity behind it. So we have the founder of this project and here, so you can meet and discuss. Yeah.
That was
and
delicious.
What else?
So that's what I'm doing for my health.
Okay.
One thing about sort of women and Ukraine. So actually, my company employs 6 engineers in Ukraine, and 2 of them are women. So we're kind of, but we just hire people who actually have sort of a humanistic approach to technology, the engineers, and it just so happens that those 6 sort of met our qualifications. But since this is sort of a business effort, they're just working for us from Ukraine, but we are actively pursuing sort of opportunities in Europe. So we're working with the Finnish health ministry so as our first time in Europe, and so we'll be very happy to expand our presence in Ukraine. These engineers may not be good at sort of leading an effort there, but we are eager to expand, and so for my health, actually, I would say that as we were discussing earlier, the food intake. My weight has fluctuated in the past, and first of all, if I travel for an extended period of time, I put on weight, period, because I want to enjoy like local foods and stuff like that. But what I've learned in the recent past, as I have entered age 45, nearly 46, is that portion control really makes a difference. And even sometimes when I'm home for long enough and I exercise on a regular basis, I'll still kind of be a little heavier, because then there's that sort of exercise and then food reward right after it, and the way your body processes it. So for me, it's just actively working on portion control and eating slowly, because of that 20-minute difference between when your stomach is full and it tells your brain.
20-30 minutes important for your brains get the signal that you're full.
But otherwise, I have no useful advice for the audience.
Okay, good. Kira, please.
Okay, 3 things. First one, I'm measuring everything to be able to discuss it with the physician, not saying, oh, yeah, a couple of days I felt not that good. So I take a very scientific approach to everything that I do. And I have tons of data about myself, and that's why I take lots of macronutrients that being prescribed. Again, do not repeat after anybody. Go and figure out what's right for you. Second is having enough sleep. I know, like, for all the business people, it's usually a thing like, oh, I will cut myself on some sleep because that's because I need to do this. Not a good thing to do. Even if you have time for some daily nap, that will help a lot. Third is, and this is not a scientific thing, but something that all the physicians say, is having positive emotions every day, looking for things that make you happy. So I'm telling you my life hack. I have Pet Cube at home. This is another Ukrainian startup. So I'm a cat mother of 3, and I'm a really bad one because I never home. But every time I feel moody or I think, oh, I'm going to kill somebody, I open it up, I look at the cats playing, and I'm thinking, okay, well, maybe next time. So that's the way. Find something to make you happy every day.
That's great. I'm actually, that's an awesome. I'm also really jealous of your discipline in keeping such good track of your biomarkers and your feelings and so on. That's something that I've wanted to do for years, and I've just never stuck to, right? Like I have months of journal entries for it, and then after that month, it always kind of like fades out. So I'd love to ask you like how you stick to it. Maybe I can learn some of your brain hacks.
I can tell you, I'm a woman, 30 plus, and I'm very afraid of getting older. That's why I'm keeping track of everything.
The guy who will help you stop
Yes,
aging,
I'm looking at him, 20 years, and I'm thinking, okay, we'll try to stay fit until that time.
Share your, because this was interesting article, James, of yours in New York Times and then Medium. So share this. I don't want to repeat because it's really amazing what you are doing. So I just want to know what you are doing, personally doing.
So I'm gonna do 3 short things. We've already touched on this one, but I guess I'll do it through kind of anecdote. There's a thing called blue zones, right? So blue zones around the world are where the highest proportion of people who live over 100 are. And one of the biggest blue zones is in Okinawa, Japan. And in Okinawa, there is a tradition that I think is called, and my Japanese is not perfect, but it's harahachi-do. And harahachi-do is the practice of, on your plate, you take 8 portions for yourself and 2 portions for honoring your ancestors. And so they leave 20% of the food on the plate and control their portions. So this fasting, this kind of like portion control thing is one piece. The second piece, the second piece is one of my favorite quotes from Mae West, which is, everything in moderation, especially moderation. I think that if you look at the data, a lot of us, especially experts in health, have the tendency to get people to worry a little too much about what they're putting into their body and what they're doing. And the incremental benefit of going from someone who is mindful about keeping a good diet and usually does a decent job to someone who is absolutely perfect is not that big of a health span difference. And as you're doing that, if that causes you a lot of stress and your cortisol increases, even getting that perfect diet might actually be a net negative, right? And so my second piece of advice is like, don't stress too much about these things. And then the third piece, the third little vignette, I guess, is that if we are all really going to live to a much longer age and be healthy for much longer, the nightmare situation for me is that what we see generally as people get older, and I think this is most appreciable when you look at the political situation, is that by and large, humans become more mentally inflexible as we age. And we all know some people in our lives who are the exceptions to that rule, right? Who, as they're getting older, are still mentally fit and can change their minds and are constantly thinking about and engaging with new ideas. And I think that the final piece is that I aspire to be one of those mentally flexible people. Like, try to change your mind on something at least once a week. Otherwise, this whole life extension thing doesn't have that much of a point, right? Like, if you just... If you just lock yourself into a mode and then your brain stops changing and you have your opinions and then you go forward for another 20 years or another 70 years, it doesn't matter if you can't change your mind about things. So I would encourage us all to like be childlike in our wonder and our ability to change our minds.
Thank you, James. And a piece of advice maybe from myself. So no drama, guys, no drama. A little bit more time for yourself. That's my advice. And I mean, just be happy because there are a lot of opportunities. I mean, we should not be just focused on something. And a part of the James didn't tell, but I'm also the member of this metformin club. So I'm taking metformin. And now about medicine. I'm taking metformin. I'm taking Elysium Health. I'm taking anti-aging cells, and it's all something which I'm happy to share, me and James, and something else. Okay, so then all this together with the sport every day. So then you will have a result. It's so easy, happy to share. So be happy, be healthy, and let's go. So, and once again, I would like to thank you, the Ukrainian House. Alexa disappeared personally. Lena, to you and all the partners and sponsors of Ukrainian House. Next year, it will be even better, even more like powerful, with the help of everybody who joined and supported. So, and welcome to Ukraine. Okay, thank you very much, and let's. Questions. Sorry. Questions. Okay.
Hi, James. I have a question for you. So what you said earlier, all the heart rates and all that measured, and it's not still not enough to measure cancer or track cancer. So we already done that. Use blood and urine. 2 years ago, lots of clinical trials, lots of data, MIT, Harvard, you name it. But it took us 9 months to get 2 NDAs. 9 months to get 2 NDAs. It seems like we have cracked the holy grail of near real-time tracking of biomarkers with pattern recognition. But all the VCs, including Fred Cohen, you probably know him, was like, oh, diagnostic, nope, we do not want to touch it. Medical device, no, we do not want to touch it. I said, why? Well, who's going to pay for it? I said, hey, the truth is, I can tell you if you have cancer or not before the first cancer cell emerge, and you tell me who's going to pay for it? So do you have some advice for med tech device and algorithm companies raising capital?
Sure. So diagnostics are hard for exactly this reason. We made a strategic decision with our fund to actually not invest in diagnostic companies for almost the same reason. It's just a different business. And so some of our companies do companion diagnostics within the development of a therapeutic, and that's where a lot of success stories come. But there is really a market for these diagnostics businesses, for sure. And I know, like, I'm sure you know your comparables, that there are liquid biopsy companies like Freenome, like Grail, that are raising a lot of money and are valued at very high valuations with the intent to do something functionally kind of similar to what you're talking about. I think it's really where I would go if I was the CEO or if I was running a diagnostics company right now, is go to the source of the people who are experiencing the pain points. Because one of the cool things that's happening in healthcare right now is that everybody's making tons of money, right? The pharma companies are more profitable than ever, the insurance companies are more profitable ever, and the hospitals are more profitable than ever. And so as the hospital systems and insurance companies, especially in the US, are like aggregating together, many of them are starting their own venture funds that are investing in things that they find will reduce the costs of their own products that they're delivering. And one of the biggest and most obvious applications here is that you can build a model to say, like, here's how we will save your costs as a health system or your costs as an insurance agency if we are incorporated into your systems, and then use that as a funding strategy.
Can I have a quick follow-up? I'm so sorry. I hope it's at least interesting for everyone. It means everything to most of the people, at least, if we succeed. That's the problem. We say we don't want to work with the insurance companies. We don't want to work with hospitals. We want to eliminate insurance companies. We want to make hospitals into only ICUs. Doctors should only be surgeons, right? So our device is for you. Take home. And then our motto is Netflix. Don't pay us. Go test your neighbors. Test yourself. Test your family. Keep your family healthy. At the end of the day, it's not about me making $1 trillion. Or potential investors. You and your family don't suffer or die of cancer, right? So that model, how would that work? And who's going to support us to get those free devices into people's hands and then make money out of data for the investors, right?
So this is where I reveal myself to be an old fart, because I'm a big believer that change happens incrementally, and that if you want to create a revolutionary technology, you can't both rebuild the system and create a revolutionary technology at the same time. That if you create a technology, the way that these things usually happen is sometimes there may even be compromises to the optimal use of the technology in order to get the first set of integration, and then if the technology is there, and maybe this is your vision, then it can grow organically into the kind of inside-out change in the system. So I would say that, at least from an investor's perspective, and I don't know the company well enough, so it's always hard to just prognosticate like this, but my investor's hat says I wouldn't go the anti-hospitalist, anti-insurance companies route. I think that those people have to be your best friends because they're the ones that are holding all the keys in the ecosystem that we live in.
Oh, and there's no doors. We don't need keys, right? But thank you very much.
Thank you.
Thank you. Imtiaz Adam. Two quick questions. First for James. James, in the drug discovery space, the speed with which it's going, and you've mentioned biology, for example, as leaders in the space, in terms of founders. Would you not say, though, the way it's going currently, you need a cross-section of skills. You need the biologists with genetics, etc. You also need leaders in machine learning, deep learning, and you also need quantum physics, quantum chemistry skill sets, leaders in all those areas combined together. Second question for the panel overall. We've mentioned women in technology. What is it going to take to get more leaders, in your opinion? I mean, in terms of what should be happening out there to accelerate that? Thank you.
So I can address the kind of broad leadership in biotech question quickly?
Well, no, the one for you specifically is, you focused in on the biology part, but would you not say biology alone is not enough?
Completely agree. So just, I think quite briefly, when we put together biology companies or biotech companies, usually there is a progression of different technologies that go into the creation of a therapeutic. It starts, for us, almost always, with interesting biology. Someone's done something cool with a mouse that has some kind of effect, an extension of lifespan, a prevention of disease, and then we try to spin that out. The main people that come into that company in the first year are exactly the sort of people that you're talking about. Synthetic chemists, peptide biologists. There's not a lot of this right now because the technology is really just blossoming, but your AI and quantum medicinal chemistry. So we are actively partnering with a number of different groups that have that expertise that we bring into our portfolio companies, usually within the first year.
Kira, please.
On leadership, I can answer on that. So the recipe is pretty simple. So you're supporting women leaders starting like from the schools, what Victoria was saying, women in coding, women in tech, coding schools, etc. We are supporting women in universities, where there are organizations, there are special leadership courses, and then we're supporting leaders, women leaders in organizations. And the most important one probably is mentorship. That's where we have seen lots of really great outcome, is supporting these particular women from the other women who reached a certain level of success, talking about it openly and going publicly about that's what you're doing, that's what your mission, gathering the communities, helping them out. This is the only one. It will not be done organically, just a little bit probably. The small piece will be done organically. The rest will be done with intention, helping of one women leaders to other women leaders, supporting them and moving them forward.
One more question.
Hi, I'm Jim Brook, Ukraine Business News. In Ukraine, we have a wonderful acting health minister, Ilana Suprun, who's former managed a women's health clinic in New York City, in Manhattan. And among her sort of private sector initiatives she told me about is clinical trials. And my understanding is the laws in effect in Ukraine are more liberal for clinical trials. And just to bring things back to Ukraine, have any of you, probably more James, thought of doing clinical trials here? It's a huge obstacle. You mentioned the cost of doing trials in the US or in Europe. We're in Europe too, but...
You've dealt with healthcare
healthcare in a number of different jurisdictions. Do you want to take that maybe? I can also add that.
Yeah, no, I'll just add a quick bit about clinical trials in particular. As I was referring before to the work we're doing at the University of Heidelberg in Germany. So actually, we are in talks with a couple of scientists now about. So what I sort of didn't get to before was our approach to healthcare, and then none of us has worked in healthcare before. Sort of like JetBlue Airlines, they only hire people not from healthcare. So we come from a background of defense and logistics, and then it sort of was just a personal journey through that our founder had, navigating his own father's experience through cancer. It's like, this is so inefficient. Why can't we bring the levels of efficiency from other industries? So we're starting. We want to look at a better way to make clinical trials more efficient, and we're looking at we're working with a couple of scientists now on starting a separate company for that. But we, not having that much medical background, I'll defer to my colleagues, but we are looking at this as a problem to solve.
So, yeah. So.
No, yeah, not yet. We're sort of starting in the States first, and we'll work our way up to Ukraine. Yeah.
So we've looked at a number of different jurisdictions for clinical trials, and I have to say, Ukraine has been a part of that list. I think the bigger and more common ones are a lot of phase 1 clinical trials are being done in India, Israel, and Thailand right now, as well as some in China, but really India, Israel, Thailand, I think are the big 3 non-Europe, non-US, and I guess Ukraine, of course, is part of Europe, but it's not regulated by the same EMA, the European Medical Agency, which is functionally equivalent to the FDA. So let's talk a little bit about quick answer on macro strategy, and then something about micro strategy in Ukraine specifically. So on macro strategy, biopharma is a somewhat unique ecosystem because it is so global, right? There are only about a dozen big drug sellers in the world, and all of us little biotech companies are competing not to become profitable ourselves, but to partner with one of these big drug companies so that they can take those drugs and put them into every ecosystem and every geography in the world. And so, for better or for worse, the US has become the gatekeeper of the world drug ecosystem, right? So most countries from Canada to the UK to South Africa have massively accelerated approvals once something gets an okay in the US. And so almost everything kind of moves through the US either in parallel or first when trying to demonstrate value to these big pharma companies. It also happens that my countrymen tend to pay much more for drugs than the rest of the world, so it's also the most profitable market, which is another reason that it goes there. That said, now, so that's why things tend to come to the US and not to other places. That said, on the more micro level, there are a lot of clinical trials being done with multiple sites. So if you do a trial that has, and this is why there's this pickup in India and in Thailand and in Israel, if you do a trial that has one site in the US and one site in another country, you can compile that data together and the FDA will look at it just the same as long as it was, well run and the data looks good and so on. And so there is really a good opportunity for a country like Ukraine, which is, very, very European, but not under the auspices of the EMA, to have an industry, and I don't know anything about the growing industry in Ukraine here, this is just pure speculation, where clinical trials could be done with the same level of professionalism as in the rest of Europe and in the US, but could be done more cost efficiently. But I think that the way to go is not the corner-cutting piece of it, and this is I want to just briefly address Charles's experience a little bit. It's not the corner-cutting piece, at least for drugs. For non-drug things, for data gathering and this kind of stuff, that's where the US is most backwards. So and so we actually have been talking with a company that's partnering in Thailand right now because the FDA is very, very, very tough with data regulations to like kind of create justifications for doing new trials, but they are more than happy to look at data coming from other ecosystems where there's like some really interesting data gathering project and then use that to approve clinical
and then
trials.
it takes, instead of 7 years, 2 years or 3 years, so then it's easier to start somewhere and just pre-approve in US, and it will take two times less time.
So it's very project specific, but there are certain projects mostly to do with data or diagnostics or med device where you can test them very efficiently elsewhere and then go to the US and they're like, oh yeah, it does look like that already works, and now we can accelerate that through.
So this is an opportunity for Ukraine. So we can. So my suggestion is let's move to the whole number 2, and the speaker is still here, so we can discuss, ask more questions, and enjoy a little bit standing position. Okay. Thank you very, very much. Yeah, and thank you everybody. Thank you.
Тобі сказати, без тебе не можу спати, і місяць по кімнаті розкинувся.